Hello, everyone. My name is Dr. Richard Horowitz, and I am the co-host of your Doctor's Talk for Healing the Lyme Summit, Healing from Lyme. And I'm with you with Dr. Debbie Hamilton. And Dr. Debbie Hamilton is a pediatrician with an experience in primary care, integrative medicine, research, speaking, and writing. And the topic of our talk today from this Healing from Lyme Summit will be pediatric Lyme disease, and we're going to focus specifically on autism, ADHD, some of these manifestations in kids who have neurocognitive deficits and ways that we can get them better, kind of the diagnosis and treatment. Debbie is triple board certified, not just normal board certification like the rest of us. She's triple board certified in pediatrics, physician nutrition, integrative holistic medicine, functional medicine. And she has a Master of Science degree in public health, and she also has done research in nutrition. She's founded the Holistic Pediatric Consulting in Colorado in 2005, and she primarily works with kids who have, for example, autism, ADHD, chronic Lyme disease. I've referred a lot of kids over to Debbie, and Debbie is one of my speakers that usually speaks with us when we do our doctor training every year. So, Deb, it's great to have you here. Thank you so much for attending, and please tell us a little bit about yourself and how you got into pediatrics and Lyme, and why you are why you are one of the few Lyme pediatric specialists in the world, and we can't really find too many of them.
Well, first of all, thank you for inviting me. Like most of us who get into integrative medicine, it's kind of a circuitous route. I said I've been a pediatrician. I did general primary care and realized that this wasn't health. Then I did research nutrition, did public health, and then ended up at a AHMA meeting. And I'm like, oh my God, there are doctors like me. And throughout that, I have now a grown-up son who has ADHD and was really struggling. And I lived at Boulder at the time and took him to he's doing acupuncture at 7 and all that. So eventually kind of came into my own practice, and, I did kind of general integrative primary care, but then really started focusing on autism. And once you start to see kids with autism and you become chronic disease, then you realize, wow, if you're treating autism, you're treating Lyme. They have chronic Lyme, they have congenital Lyme, they have mold, they have autoimmune issues, they have GI issues, they have everything. So if you start treating autism, you really have to go and start treating kind of all of it. And so you kind of, I joined Research Nutritionals, I start getting more involved in some of their products and developing their products, but really attended a lot of the Lyme conferences, and it really kind of came together. And when you treat children with autism, you also treat families. And so when you're treating, you find a child with autism has Lyme. Well, wow, their parents often do too. So you end up having to treat. So now I treat adults too, because I treat families essentially.
Right. So, one thing you said earlier, which was really fascinating, I think for people out there who are listening, autism is one of these mysterious diseases that, they think that nothing has been discovered about this disease. The kids have to stay sick, but you were kind of implying in all of these. And by the way, how many thousands of kids have you seen with this at this point?
Over 20 years. No, I don't even know. But autism and then ADHD is kind of within the spectrum, sensory processing, behavior, developmental issues. So you kind of get the spectrum.
Right.
And some of the causes are the same for a lot of them. You have to look at some of the same things.
But there really are things, and that's what we're going to discuss today, is we're going to discuss some of the diagnostic and treatments that you have found effective, because again, I think a lot of people out there don't know that there really are any effective treatments that you can give to these kids.
Right. Well, autism is diagnosed as kind of like a neuropsychiatric illness because it's diagnosed with a questionnaire of symptoms. But when you do integrative medicine, it's like, well, what's the cause of those symptoms? Or are they banging their head because they have a headache, and what's causing that? Are they not eating? Are they reacting to a lot of food because their immune system and their allergies? You have to look at their gut. And so I really kind of break it down. And there's so many layers with these kids. You always have to start at the basics. But the way that kind of in the integrative and like in the MAPS community now is kind of the new autism ADHD community, is they are causes. These are biologic issues. These kids have neuroinflammation. They have chronic gut. They have chronic infections. They have autoimmune issues. And if you really look at that, you can help get them better. To look at it as just, they just have neuropsychiatric illness and that's their diagnosis, doesn't look at the cause, or it doesn't give you much to do with to help either.
Right. Can you explain briefly for the audience the differences between the symptoms in pediatric Lyme and adult? Because I mostly see adult, and I know there are some
Yeah.
symptoms that are a bit different. Can you discuss that for a sec?
Yeah. So the way I think about it is, you know, kind of there are some kids, the kids who are what I say do not have autism, do not have kind of underlying neurodevelopmental diseases. Some of them, like some teenagers, could come in with the same kind of symptoms, headache, fatigue, pain, things like that. The majority of the kids, somebody will come in just for fatigue or they're passing out. I'll have kids come to me for POTS, POTS syndrome, and you'll have to look back at that. I'll get kids just for like, a lot of ADHD or, something that came on news, like, wow, all of a sudden they have brain fog and they can't pay attention and they're falling asleep at school, so sometimes they don't come with like a complete picture. And then the kids with autism present with autism, and maybe you don't know if they have headaches, you don't know if they have joint pains, they're hurting themselves, like self-injurious behavior, SIBs. If they're banging and they're pushing on themselves or they're just acting out with rage, that could be pain, that could be infections. So you really have to think, kind of always have to have that in your differential for some of
Hmm.
these chronic kids, because they're not gonna, they're gonna present with autism or present with ADHD.
Right.
Does
Now,
that
so
make
so
sense?
you're specializing, obviously, you decided as a pediatrician to specialize in autism, ADD, ADHD, and you're seeing obviously a role for tick-borne infections like Lyme and Bart. And can you explain a little bit again to the audience, like what is the role? How are you seeing these infections driving some of these neuropsychiatric symptoms?
I think of them as driving a lot of the behavior issues, probably from causing inflammation. Probably, as I said, we don't know if they're in pain. They have like a lot of low muscle tone. So think about mitochondrial issues that they're causing, but it doesn't present like, hi, I'm chronically fatigued and in pain. A lot of these kids are running around. So their parents are like, they're not fatigued. I'm like, they have no endurance, you know, they run out of energy. They can scream for a while.
Mhm.
Um, or the kids with autism are suddenly just like the pandas autoimmune behavior stuff is always a big red flag for me with some of these. Even if you have a chronic kid and all of a sudden they're like, wow, they're really acting out. Something's going on. Something is new. They've been triggered, they're regressing, something's happened, kind of thing. You always have to keep it, infections, gut issues, mold, you know, metabolic, mitochondria. You have to kind of think about all these allergies, mast cells, everything that all adults do. You have to think about all of that in some of these complicated kids. Does that make
Right.
sense? Because and a lot of them, they're layers. You just peel one layer off, you treat layer by layer. You know, these kids are really, really sick. And I think that's what people have to realize.
Right.
These
So,
aren't just kids acting out.
so the 16-point model, you're one of the regular speakers I've had when we do the doctor trainings, and you've heard me speak about the 16-point model. You were just mentioning a lot of things on that model that sounds like they were associated with autism,
Yeah.
ADHD. So, and obviously you're saying that it's not just obviously Lyme and infections. You're seeing mitochondrial dysfunction and POTS dysautonomia and gut issues and detox. So, is it you are pretty much seeing a lot of these factors on the 16 points, some more than others, driving the illnesses in these kids, or all of them are there?
They're all there. It definitely, you know, one parent said, and this has been going on, you see one child with autism, you see one child with autism because they're so different, but you always have to think about all these different factors. And I've never had, you know, and in doing this for 20 years, kids are a lot sicker. And I talk to adult doctors that people are getting sicker, and the kids who are treating the kids, it used to be you get, oh, a child regressed at 18 months, you give them B12 shots, you put them gluten-free, casein-free, you treat some gut issues, they get better. Obviously nutritional support and everything else. And now it's like, okay, and now what? And then what's next? And really kind of keep going, but they're all involved. And you really have to look at, as I said, step by step, but looking at all these kids. It's
Right.
not a quick fix.
Right. And I think the key here is, and I want people to realize this, a lot of the kids that would come to me, and I don't see as much kids, but they come in on Ritalin and things, drugs that basically try and keep them awake and keep them concentrating. Your take, though, is you may use some of these medications, but of course, the source, getting to the sources, right, of where this is coming
Right.
from is key. So do you find that once you start treating the sources, like you've treated the mold, you've treated metals, you've treated the infections, that some of these drugs are just no longer needed at this point, that the infections and
Yeah,
toxins really are playing a big role?
right. A lot of the medicines, as I said, they're basically band-aids. They're trying to symptoms. So you have like the Ritalin ADHD medicines, and then you have like the kind of antipsychotics, like the Risperdal kind of stuff, which creates so many other issues, and then you have no idea what's going on.
Mhm.
And that from the psychiatric ones, you can get those kids off of those kids because there's long-term weight gain, all sorts of such issues. There are some kids who get better to a certain point, and still sometimes Ritalin does make a difference. I do have kids with anxiety. I'm very integrative. There are kids who, Zoloft can help with anxiety sometimes. Ritalin can help. The goal is obviously not to have them on medicines, but then I also don't want families, while these kids are functioning and, a little bit of Ritalin really makes a difference. And it's very personal. But as I said, I've had kids come in and they're on so many different medications, and you don't know, because I do see a lot of kids with like mood, behavioral issues, a lot of the rage behaviors come in, and then you kind of figure out some of the PANS autoimmune stuff.
Mhm.
But yeah, but I also don't want parents to go, oh my God, I can't get my child off this, and they feel like a failure because I've done this stuff and there's still a little bit of Ritalin or whatever. I'm like, that's okay. 5 psychiatric medicines, but definitely try to get them off Risperdal and those medicines. So it's kind of a balance, honestly.
Right. So you mentioned for the audience out there, although there will be doctors, a lot of these maybe patients or mothers or fathers. Can you explain a
Yeah.
little bit about PANS, about pediatric autoimmune neuropsychiatric, and like how do you make the diagnosis? How is it different, right, than some kids that just may have ADHD? What is this autoimmune
Right.
component? Where's it coming from?
Um, it used to be originally we realized something called pandas. So some people still call pandas. Yeah, excuse me. Um, and kids would get a strep throat, and their body would have an autoimmune reaction, which basically cross-reacted with their brain, so caused a lot of behavior issues. And it was like they're fine, they get strep the next day. People wonder who possessed their child because their behavior is so acute, rage, they can't leave the house. Some kids present with like serious OCD. Um, and so that was starting to be recognized. What's not recognized as much, especially kind of in general neurology, is the chronic kids or the kids with autism who suddenly get infection and then regress and have behavior issues is not considered the same thing.
Mhm.
So, and I see a lot more kids where it's not quite the classic pandas. I got sick the next day. It's really these kids, and then they have a lot of these kids will have fatigue or they'll have severe behavior issues, and that's what they come to me for.
Mhm.
And sometimes on and off for years, right? You can think about kind of flares and up and down things. So they come to you, she's getting kicked out of school. She won't leave. She's wetting the bed now. I've had a kid who totally neurotypical who went and stopped speaking. They can have really serious regression. So if kids already have some developmental issues and regression, it's not always correlated. But
Mhm.
basically, autoimmune issues from infection that's causing behavior issues, basically kind of autoimmune to the brain, essentially.
Right. And it's not, and in this case, it's not just Shep. You're seeing some of the same autoimmune manifestations from Lyme, from Bartonella, from other viruses. Like what else are you seeing that's driving the autoimmunity?
Yeah, mycoplasma is a big one. And that's, very common kind of, I think of with a lot of people who have Lyme and Bartonella. Bartonella for me, I think of Bartonella as that rage behavior. I think of that as really very much of a neurologic disease. So I've seen some of the worst behavior. I heard someone said if their parents come in and think my child's possessed, then you got to think of Bartonella. I mean, it's really
So in other words, if the parent comes in and says, my child's possessed, do not take them first, right, to a priest to do an exorcism. The first thing that you should
yes,
do is think, does my child have pediatric autoimmune neuropsychiatric from an infection, right? Other things going on, that this is not necessarily, right, demonic possession.
right, exactly. So Bartonella is big, and if you have one, of the Lyme infections, the tick-borne infections, you always test for all. And what I do, especially with that, is a lot of times you mentioned diagnosis. So there's something called the Cunningham panel, which is kind of some of the people who first studied, the pandas with the strep, and it's an autoimmune panel. Plus, it tells you enzymes, so it's very good. It gives you a lot of great information. But I want to know what's causing it. So my first line is like, okay, what infections do we have? We're going to test for the Borrelia. We're going to test for Bartonella. We're going to run all these panels. I always look for mycoplasma. I look for EBV, although I don't think of that as much kind of symptoms. but I test for a lot of these different infections. Strep antibody titers are a whole other thing because I don't think that that's very helpful, but that's what general pediatricians, if you have strep, you have strep antibody titers, we'll give you amoxicillin for 2 weeks, you're good. That doesn't work. Nancy O'Hara wrote a book about pandas, and she said mycoplasma is actually one of the number 2 causes, that it's actually very common and really, so yeah, so the Cunningham panel, I use it much more if, we've been treating, we've identified the infections, these kids are really not getting better, we've tried different combinations of treatments, is that what's really going on? And that's when I get the Cunningham panel. I'm like, okay, yes, this confirms that, okay, that really is going on. Or, hey, maybe it's really just a mold issue, and we're really not targeting that correctly. I used to do more Cunningham panels. They are expensive. They take a long time to get. And a lot of times, even if I didn't find them, the pattern, the picture, and the infections, and kids get better. I mean, that's, how I address it.
But you need the Cunningham if you want to try and get IVIG for some of these kids. Do you need a positive Cunningham panel to be able to do it, or you're able to get them sometimes to help them even without one?
Not necessarily, because depends on, what children's hospital you're doing. They don't always believe that. And if I send a kid with autism, and I hope this has changed, but a kid with autism and PANS, they're like, no, this isn't it because they have autism. So even with a panel or not, just because it's not the classic pandas change overnight, typical kid, they don't always do the IVIG. Because if you do get that picture, the strep antibody titers, even without a Cunningham panel, the neurologist will do the IVIG. There are some immune centers who will do it and really can get good coverage. Sometimes, like if the immunoglobulins are low, that can help, because you kind of like, oh, well, there's actually immune deficiency. But sometimes it doesn't matter, and not everybody recognizes the Cunningham panel in traditional medicine either, unfortunately.
Right. So you don't always need to, I'm sorry, you don't always need to use IVIG then in some of these kids with pandas. You find that by treating the infections, treating the mold, getting to the underlying sources of inflammation, leaky gut, food sensitivities, mast cell disorder, getting them to sleep, right? All the big stuff, that a lot of these neuropsychiatric symptoms do get better in the kids?
They definitely get better. IVIG, the classic, as I said, classic pandas, kid changes overnight, 1 dose of IVIG, but it has to be high dose. Those kids get better. In the chronic kids, I haven't seen it, because a lot of kids come in like, oh, I tried IVIG, I'm doing it every 3 weeks, didn't really make a difference. I think it can help. It is definitely not the only thing. Does that make sense?
Yeah, no, it actually does. And I think this clarification is important, because for those, who are out there who know a little bit about pandas, it seems like everyone goes first to IVIG, but you're saying these underlying sources of inflammation and downstream effects, mitochondrial dysfunction, right, hormone disruption, right, all these neuropsychiatric symptoms, you can do without it. It's only in the classic, I get strep, I suddenly get sick, right, that you're seeing this happen.
Right. And those kids have often been treated for strep, right, and then had the autoimmune. So, and usually it's pretty quickly, and then they get it. Those are the only kids I've seen, like the 1 dose, high dose makes a difference. And I said, a lot of kids come to me, but if you don't treat the underlying cause, you're not getting rid of the autoimmune disease. You're not getting rid of the inflammation. You're not getting rid of the infection. It's kind of like, okay, well, and they don't even know exactly how IVIG works for autoimmune disease. Is it just kind of displacing some of those antibodies, and it lasts about 3 weeks, and they want to give it another 3 weeks?
Right. So there's still some unknowns. So how do people get in touch with you if they have a child who's got ADD, ADHD, autism, PANS, et cetera? How do they get in contact with you? And do you have any upcoming summits, conferences, anything you're doing that people can attend?
I said, I'm going to be at the MAPS conference, and MAPS stands for Medical Academy of Pediatric Special Needs. And I'm talking actually about pandas. I'm part of a health summit. I think it's actually from Australia. So I can get people information about that. I'm going to lecture on GI issues and allergies. It's best probably to contact me through my website or email. My email is Dr. Debbie, DRDEBBY, at holisticpediatric.com. And holisticpediatric.com is my website too.
Great. And you're in Colorado, correct?
Yes.
Great. Okay. All right. So let's jump back in again. So we've been discussing pediatric Lyme. We discussed that you will see some symptoms that are a bit different in adult. By the way, the kids that I have seen with pediatric Lyme, which is not a lot, do you see a lot of these GI symptoms in the adults? Although I will see IBS and SIBO, small intestinal bacterial overgrowth, and microbiome disruption. The kids who have come in do seem to have more GI problems than some of the adults, at least that I've seen come in with this. Do you see anything specific with that in the kids who are coming in, or you're seeing pretty much the overlapping? Pretty
I
much.
see the overlap. I mean, the vast majority of kids with autism have some kind of GI issues because they have the, dysbiosis, even if they don't have GI symptoms. So I think about that as part of their immune dysfunction, which is why they're more susceptible anyway to having these chronic issues. So, and kids, kids in detox is different. So kind of you see things, when kids get sick, they get a flu and they'll throw up, or, things come out in their skin. So they have a lot of weird skin rashes. So I think it's just how they present, if that makes sense.
Right. And do you notice with the microbiome? I mean, because it has been talked about a lot in Alzheimer's and Parkinson's and MS, right? They're finding Prevotella species and Clostridia and not enough Akkermansia. Do you use like the GI map? Do you use the CDSA? Like, what do you use to diagnose the microbiome in these kids, and what do you do for them?
Yeah, so I do the CDSA. I did some of the genetic tests. I'm still kind of old school. I like to see what actually grows. And I like a lot of the absorption issues and inflammation markers. I do the OAT panel, this organic acid test. A lot of people call it the OAT. That has some dysbiosis markers and even has some Clostridial markers. A lot of kids have overgrowth of different Clostridia species, and that can cause a lot of anger and behavior. Obviously, yeast overgrowth, but just really imbalanced bacteria. So if I can get two of those are really, for me, a good combination. Plus the oat gives me mitochondrial markers and glutathione markers and nutritional markers, a lot of different stuff. So that's what I use primarily for
Right.
mitochondrial
I
testing
can't
also.
do this is Great Plains because I can't do oat in New York. This is through Great Plains, or it's a different lab?
Yeah, and Great Plains is now Mosaic, but that's exactly what I've used. And I tried a lot of different ones, and then especially in terms of some of the very specific Clostridium, even like different types of Clostridium markers. So that's the one that I've used. And once I started using it, that's one I always used. So, but it's now Mosaic.
So when you go after it, so let's say you treat the kid's candida, you go after the Clostridium, and you're talking like using things like vancomycin in these kids, like you would for somebody that might have C. diff, not difficit or the classic drugs. But
yeah,
how are you doing this?
It depends. Like, I mean, they're different. Some different probiotics. Like I think of Lactobacillus rhamnosus. I don't use S. barlardi as much because I think some of my kids react to it. But doing a lot of probiotics. Kind of a lot of different, immune support, other gut support. But I have had kids who come in with like really bad chronic watery diarrhea and have C. diff, and absolutely I treat with vancomycin. And some of my sicker kids with autism, I do the probiotics and the medicines. I said I was integrative general pediatrics, and I was like, oh, not using any prescriptions. And then I get these kids autism, and they're so sick that you really do need your whole spectrum of things.
Right.
So I definitely use prescriptions.
And you're finding after you treat the gut, you treat the yeast, you treat the Clostridium, you treat the leaky gut and associated mast cell or sometimes SIBO. The gut is really one of those primary issues that causes some of these symptoms in the kids, right?
Yeah, absolutely. Like the first thing you have to do, diet. I always do diet and gut. Somebody said you got to remove the things that are hurting. Is it the yeast? Is it the Clostridium? Is it the different foods? Getting the good bacteria in there, and then repairing the gut, healing the gut lining, things like that.
Right.
So yeah, that's always my first line. It's like diet, nutrition, a lot of nutritional supplements. A lot of these kids are very low on certain nutrients, and treating the gut. Absolutely.
Now you're on the board of Research Nutritionals, and a lot of the new supplements coming out from them. I know you're designing them. What are your favorite supplements in these kids? Like whether it be for gut health, or you're pulling out at this point mycotoxins, right? Or glyphosate. I mean, talk a little bit about some of the products you like actually in these kids that you're finding are helpful.
Yeah, well, glutathione, we have a called tri-fortified glutathione. So think of glutathione as your master antioxidant. It's watermelon orange. Basically, it's a good dose. It's researched, which I always like, and actually am involved in some of the research. Plus, you can get it into kids, so that's huge. We have ATP 360, which is a mitochondria supplement, which has support for phospholipids, but also like some of the key nutrients you need in mitochondria. You can open them up and mix them in. for kids who don't swallow pills. So any of these capsules are easy. And sometimes it's almost easier because sometimes different flavors and textures are hard.
Mhm.
We have something called BDNF Essentials, which is designed to kind of, it was basically designed as one of them. I also design in terms of called neuroplasticity, but I feel like it's like supporting the brain, like lion's mane and skullcap and phosphatidylserine, and it helps lower cortisol. So I designed it making sure there was no ingredients that were activating, you know. So that's kind of calming. And we have research that just came out on that about decreasing processing speed, helping mood, helping memory and kind of lowering cortisol. So those are kind of some of the big ones. Um, with Lyme, I use a lot of our tinctures. We have 4 different tinctures, one from yeast, one's really targeted for mycoplasma, but also is great for Bartonella. So those 2 as I use. One is more helpful, Crypto Plus, that's helpful for Babesia, but also for Lyme. So I kind of use those. Um, Transfer factor multi-immune is kind of our general multi-immune support, but really helps like the natural killer cells to really help at getting that immune system so you can fight infections better, balance the immune system. Um, I think those are some of the big ones. We have a liposomal CRLA. So that's kind of I like that combination of vitamin C and our lipoic acid. That's kind of an addition to a lot of things I do. Histoquel for mast cells and allergies. Um, it's good when you design things, you're like, oh, I want a mast cell product that has this in it, or when I design BNF, I'm like, oh, it's like the perfect ADHD kind of mix. Oh, Bacopa and ashwagandha and, calming, supportive, so it's kind of nice that way.
Right. I
But I
mean,
use a
you've
lot of
actually,
different
I
things.
mean, you've designed the way they put these together, and you've got to see it in clinical
Right.
practice of how it actually works for these kids. And by the way, I mean, I use Research Nutritionals mitochondrial supplements all the time, the ATP
Yeah.
360, the CoQ Power, the Cardio Ribose. I mean, I'm using them pretty much every time I finish the Dapsone protocol.
Yeah.
I'm using it for these kids. Talk a little bit about the binders that you've developed. There's a lot about gluten now. I'm going to be interviewing Dr. David Perlmutter actually very shortly about,
Yeah.
of course, with grain brain and gluten and the effect
Yep.
on. Do you see the effect of these kind of foods and gluten on the brain and pulling out glyphosate and stuff? What are you seeing in these kids regarding their neuropsychiatric with this?
I mean, gluten is inflammatory. I always talk about like gluten is like glue, right? It's like this big, big protein molecule. Um, and the one problem our gluten is there's a lot of glyphosate to the way that basically they spray the wheat with glyphosate before they harvest it. So it has a lot of glyphosate. So I think some of their gluten issues might be glyphosate.
Mhm.
Um, so kids always have a trial of gluten-free, dairy-free. I do allergy testing, but there's so many ways people react. And the gluten morphin they can cause definitely behavior issues. So all my kids have a trial of gluten-free, dairy-free, often soy-free. Um, there was a parental kind of, they basically asked parents, so children with autism, like about different, treatments and how often does gluten-free, casein-free help? And this was several years ago, but it's like 60, 70%. So I think it's worth
60, 70% of the kids got better getting
not
off
not
of their allergic.
recovered, but definitely, yes, definitely got improvements. And I think in terms of treating the gut, if you're trying to get the inflammation down, you got to get these foods out of there, even if it's not permanent. Does that make sense? Well, you treat the gut, I think people do much better when they're off of these foods.
Right. Well, I mean, the problem with leaky gut, at least in the adult population, the vast majority of people I see now, when I do a 95 food allergy panel from an IgG4 from even LabCorp, the vast majority of people are showing up with multiple food sensitivities. And the problem with the Lyme and tick-borne is that it drives the same inflammatory cytokines you get from the tick-borne. So if you're eating the wrong foods and you've got gut inflammation, right, it's like I discuss it as like rivers of inflammation going into an ocean of inflammation, right? And I think you're seeing the same
Yeah.
thing in the kids, right?
Right. And the kids, if you think about a lot of those kids, all on the spectrum have a lot of sensory issues and a very limited diet. So this can be a serious issue because a lot of kids, it's almost like they're addicted to gluten and dairy and that's all they want. So changing a diet in some of these kids is really tough. Luckily, the foods are much better, but they have to get the dyes out and the junk out. It's kind of
Mhm.
what you eat, it's what you don't eat. And some of the kids that, there's some very other specific carbohydrate diets, and sometimes kids really, for a little while, and you got to worry more about malnutrition. You can't be as restrictive in kids with diets. right? Because you have a growing child. But sometimes getting the grains out, and if you can really get, sometimes that is a big deal, depending on. And I've had some kids who, a child on a specific carbohydrate diet who literally got rid of their autism. It
Mhm.
was like that, and some probiotics and some herbs for dysbiosis, and they're gone. I mean, they're kids who do really recover, but you have to do the gut stuff or they really don't. It's
Right.
a big impediment for kids getting better if you don't address the
Do
gut.
you have a sense? I mean, the autism rates, when we're watching this for the last couple of decades, it used to be something like
Mhm.
1 to 350, and the last one I saw was something like 1 in 38 or something that I saw. Do you have your own
Yeah.
sense as to why we're seeing so much and why so many of these processing disorders, all this ADD, ADHD that's out there, is it infections and toxins that's driving this in most of these kids? Like, what do you think is behind all of this?
I think, well, I wrote a book on preventing autism and ADHD because I was in the practice, and when I started writing the book, the odds are 1 in 150. And that was like 2008 or 9. And now there's like 1 in 38. And it's much higher in boys. So it's actually like up to 4% of our boys and getting worse.
Hmm.
So there's got to be an environmental component, right? Because if that's like 20 years and our kids are sicker, not just more autism, but sicker kids, then there's
Mhm.
got to be some environmental. I think glyphosate, I think toxins, absolutely. I think if you don't have a healthy mom, and we're getting generations, if you have a mom with Lyme who has poor nutrition and dysbiosis, the baby's going to, through normal delivery, they get the mom's microbiome. That's how they establish their microbiome. So some of these kids, right from the get go, they can have congenital Lyme. They cannot have, you know, like a proper microbiome. So they're going to develop allergies. They're going to develop like dysbiosis. They're going to get eczema, that's going to affect what they absorb nutritionally. Then they get something on top of it. All of a sudden they get COVID, or all of a sudden they get, the flu, and it kind of goes from there. But I think that's part of it. I think this environment, we're having, moms with autoimmune issues, infertility, having babies later, parents aren't as healthy, and then we have more and more in our environment. We're learning about the plastics and
Right. And you've seen
and
congenital
stress.
Lyme. I mean, do you see quite a bit of I it's always questionable because whether the kids are crawling in the grass at 2 years old or whether the mother transmitted it, of course, is the big question. But you have seen cases of congenital Lyme contributing to these neurodevelopmental disorders?
Absolutely. As I said, it's a little hard because you don't know exactly, but there's a different presentation the way I see it. So the kids that I've seen, where I'm like, yeah, this is definitely congenital, are the kids who have issues right from the get-go. And not just like, I mean, autism, but developmental issues. So these kids, to me, I've seen kids with really low muscle tone and developmental delay, but like walking late. And so the talking late gets them sometimes diagnosed with autism, and the mom usually had some kind of chronic fatigue or something like that. And then the kid, as I said, is sick right away, as opposed to the 18-month-old who was doing fine and then had regressive autism. Does that make sense? And I had a mom who the child with developed autism had the exact same picture. Mom was diagnosed with Lyme. We diagnosed the child with Lyme. We treated her. She completely recovered from her autism.
Hmm.
And then mom got pregnant, was treated during pregnancy for Lyme. Second child was completely fine, no
Right.
issues. But
Um,
it's a bit of a different picture when I would think about it more.
right. And the hypotonia, this low tone that you're discussing, is one of the really the
Mhm.
classic symptoms of pediatric Lyme, right? When you're examining a child when they're very young.
Which is a mitochondrial dysfunction, right? Low
Right.
muscle tone, because it's kind
Right.
of poor endurance, is how I think about it.
Right.
It's like they can't, these kids are literally like floppy,
Hmm. And
if you kind of
regarding the
got a baby.
mitochondrial dysfunction, when I've listened to Bob Navio talk about the cell danger response and that the mitochondria get stuck, one of the theories that he had was that there was a lack of enough extracellular ATP, and that, if you would give a drug like Suramin that's used for sleeping sickness,
Mhm.
right? These autism kids, their brains would all of a sudden wake up. Now, you can't get the drug in the United States, and the closest
I
I've
know.
ever seen is broccoli seed extract, like sulforaphane glucosinolate. Hopkins did some studies showing the same. Do you think the cell danger response in the mitochondrial, like getting stuck in a place, is responsible? Because Bob's theory about, the cell danger response in mitochondria is that some of these autistic kids, if you could just get the extracellular ATP up, it would be better. You're, of course, saying, no, it's multiple sources of inflammation. Like what I'm seeing, it's Lyme, it's BART, it's the microbiome, it's leaky gut, it's environmental toxins, it's mold, it's mitochondrial. You're seeing the whole picture. Can you, do you think the cell danger response plays a role here? Do you think drugs for extracellular ATP may be useful for autism?
Yeah. I mean, I don't think anything is just one thing, but I've looked at his work and I've heard him speak, and the sermon studies for these kids is impressive. And as a parent, you're like, wow, this could be so amazing. This could help so many kids. And in studies show it does, and you can't get it. I mean, that to me is just unbelievable, because it really
I feel the
does seem
same
like
way
it's a
with it, yes.
switch. But I think if you think about, I think about the cell danger responses, wow, the body's under attack. And what do? I need to protect myself. So I need to shut down, essentially. That's how I think about it. And the mitochondria is shutting down, right? You don't need to put out a lot of energy if you're in survival mode. And then, but right, getting that out, helping the mitochondria, but getting them out of that system, the mitochondria in the different stages is hard, but why is that? But whatever is causing that kind of shutdown, is it the infection causing that shutdown, the mitochondrial shutdown and the cell danger response? Because it's a danger response to everything in the environment. And if you have multiple things, you still have to address the other things so it doesn't shut down again. It's like turn the switch on, but there's still stuff that's going to turn it back off.
Right. So question, I mean, knowing the autism rates are going up that much, and I see so many young people coming in on medicines like, Ritalin, Concerta, et cetera, Strattera, to help their brain function. It's always like the doctors are naming a disease, throwing a drug at it, but not getting to the sources. So, a question I would love from someone like you, who's really at the forefront of this, if you could create an NIH Center of Excellence and you had a chance to see these autistic kids in the ADD, ADHD, how would you design the Center of Excellence with the diagnostic testing and things? How would you design this with treatment trials so that we can move this ahead? Because this is a real problem that's starting to affect so many parents and kids.
Well, first you have to have your preconception. So every woman should have a preconception evaluation with kind of an integrated approach, and have how is her immune system? How's her microbiome? Does she have toxins? You got to detox before. You can't detox a pregnant woman. So you got to start there. If you have healthy moms, you're going to have healthier. And you have to start right from, and pregnancy. Is everybody have a prenatal? Is their vitamin D adequate? Or their thyroid's adequate? Are they exposed to infections? If they have Lyme, you got to treat it. So babies are born, kind of not behind the 8 ball, so to speak. I think you got to identify kids earlier. And there's kind of slowly getting, a lot of times it's general pediatricians, sometimes it's parents, but the earlier you get them, the earlier you start treatment, the better. But knowing that it's not just one thing, so you can't just say, hey, we'll just study vitamin D and autism and think that they're going to get better if their levels are adequate, because it's so many things.
Yeah.
So you do need to kind of look at their immune system and look at the nutrients, the zinc and the iron and the omega-3s and vitamin D and B12 and all of those. I do think some of the genetic SNPs, especially early, can make a difference. Thinking a lot about some of the folinic acids and some of the folic acids. I mean, the folates essentially. So really kind of looking at that, looking at the stool, looking at the microbiome right away. So you really can support these kids right away, essentially identifying infection. So it really have to be very comprehensive. It's definitely not a kind of a one factor kind of study. And you really need a team, right? Because these kids still, as they're getting better, still need the behavior. They need behavior therapy. A lot of these kids need speech therapy, occupational therapy. Sometimes they need physical therapy. Sometimes there's a counseling, kind of working in behavior, helping the parents. This is life-changing for parents. I mean, this is a serious burden. I see a lot of really depressed, and I would say burnt out moms more than dads, but burnt out families. And that's a lot. That's hard to take care of and manage all of this and all that.
Right. So question, in my adult population, when I give them dapsone combination therapy, their cognition and a lot of the neuropsychiatric gets worse. Of course, it can hurt people right before they get better.
Yeah.
Glutathione in some people, I mean, it's probably 70-75%, they get some effect where it clears their brain fog. Do you also see in the kids like similar effects with this, where you're giving them high dose glutathione, you're detoxing and lowering inflammation, and their brains do wake up. And have you ever used Dapsone in the younger population? Because one of the nurse practitioners I trained earlier, one of my patients who I'm still dealing with, who has, she's very complex with Lyme Bartonella and has Morgellons. Her child has autism. And the nurse practitioner gave the child at some point a very low dose of Dapsone. It was like 25 milligrams, and the kid's brain woke up. And I said, you've got to write up this case study. It's like nobody knows about this in the pediatric population. You have any experience at all using these kind of treatments?
We have spoken with that. We actually spoke about this earlier, and I have not yet. I'm still I keep looking at it. And I definitely do combinations of, I always do prescriptions and herbs and a lot of supplements. I haven't gone there yet. As I said, I keep looking at it and testing for that.
I think the way to put your foot in the water may be just like start with just ridiculously low doses in these kids, like even 25 Dapsone twice a week or something, because it has a long half-life. And just see how it goes. Because as long as you're giving enough folic acid and they've got enough B12 and iron and stuff, you're not going to see any major anemia with the really low doses of it. I'm just curious because the autism epidemic is just getting worse and worse every decade. The numbers are getting worse, and all these kids got ADD, ADHD coming in on Ritalin, Strattera, Concerta. And I'm just concerned, like, with throwing medicines at people, a lot of the parents don't know what to do, which is why we're speaking. And so let's kind of sum up, because we're getting close to the hour in just a little bit. So let's sum up with what you've seen so far in these neuropsychiatric effects in kids and autism, ADD, ADHD. The factors, the inflammatory factors you found the most: Lyme, Babesia, Bartonella, mycoplasma, microbiome, mold, heavy metals, sleep disorders, food allergy. Those are the big ones you're seeing in these kids, right?
Right. Well, definitely all the gut issues. I said all the infections you mentioned, a lot of nutritional deficiencies, food reactions. You really have to do all of it. I said, you can't address all of this at one time because you're going to make people sick, right? You have to kind of do step by step.
And with the foods, not just an IgE, you want an IgG4, you want the delayed hypersensitivity, right? Not just the regular.
And when you're checking, I said sometimes.
Yeah, when you're checking for leaky gut, using zonulin lab specifically, like you like for checking leaky gut in these kids?
I still do. I said I used a lot of the doctor's data labs because I've done that for a long time. If they have multiple food reactions, IgG, they have leaky gut.
Okay.
Right. They do. I just kind of find out, I'm like, what are they reacting to? Kind of, how is their digestion? How's the inflammation? Where's the microbiome? What do we need to treat? That's how I think about it.
And these kids are also coming in like the adults. They're coming in with the downstream effects of inflammation. Like you get brain fog with POTS, right? You have low blood pressure. You don't get enough perfusion. You're also seeing this, not just from long COVID, but you're seeing it in chronic Lyme disease and BARD and in the same population.
Right. Before COVID, if somebody came in with POTS, I had to rule out Lyme, Bartonella, Babesia. That was like my first line. You have to look at the infections.
Right.
For me, that's kind of how a lot of, especially teenagers, present.
Right. So you are seeing you're in my population, it's maybe about 40%, maybe getting close to 50 that I'm seeing POTS dysautonomia, showing up. You're seeing it in the peds population too?
Oh, absolutely. I feel like it's harder to identify in younger kids, especially kids with autism, but that's sometimes I get teenagers who come in with POTS, and that's why they're coming to see me.
Right.
Like as the only presentation.
Right. But if these kids have really severe neuropsychiatric issues, you're always going back to the basics of, is Lyme and Bartonella there? Especially you said the rage, right? I see it in the adults. I'm seeing psychosis. I'm seing hallucinations. I'm seeing OCD. I'm seeing bipolar disorder. Like pretty much every severe neuropsychiatric I can see in adults, mold, heavy metals, Lyme, Babesia, BARD, it seems like these culprits keep showing up. Obviously, there's genetics. We're not, denying it, but it does seem like they're playing a huge role. And you are seeing the same thing in the kids too.
Right. Well, one thing that we're also seeing, kind of like the pans, but I see it in Bartonella, is kids who come in with like eating disorders. They come in with like an anorexia picture. Like they're so like ICD, they're like restricting, they're down, like they're over exercising. I had a kid who wouldn't even sit down. They're like, oh, I can't eat this. I can't eat this. It's almost like an OCD, and they start losing weight. And it looks like kind of the classic anorexia. picture. But if you look at, oh, well, they're also having separation issues and they're also having this, and you can actually find Bartonella and some other infections and treat them like a PANS, and the eating disorder goes away.
Right.
That's
Right.
kind of something, especially as pediatricians, like if this looks like a classic anorexia, you still need to identify it and think about it as a part of like a PANS picture, kind of that autoimmune picture, and think about infections.
Right. So the basic message kind of for everybody listening out there, especially if there's a sudden onset, from when you said before, a sudden
Right.
onset after an infection, you think PANS pandas, but you can have still these low grade kind of neuropsychiatric symptoms, right, from mycoplasma, these other infections and toxins that are still
Yeah,
causing these
absolutely.
symptoms. Yeah.
Right. It's not like an overnight, but sometimes it's kind of over weeks, and wow, their behavior keeps getting worse and worse. And then all of a sudden, wow, they're not eating, they're not doing this, they're up all night, they lining up their foods, the only thing will eat yellow. I mean, it gets very, very specific. And so
Hmm.
sometimes they come in just for behavior issues. Like, that's another thing I get. People come in really bad behavior issues and not knowing why. What do we do? And
And
usually
that's
those kids have been on multiple medicines or are on multiple medicines, and you have to kind of figure out why.
right. So again, it's going back to the what I call the three I's: infections, inflammation, immune dysfunction. But are there toxins? Are
Mhm.
there mineral deficiencies? Right. Food allergies, mast cell, right, et cetera, in these people.
Right, exactly.
Yeah.
Yeah.
So, I mean, it sounds like there is hope. A lot of people, I think, when they think autism, they really think there's no hope for these kids at all, or ADHD, ADD, they think, oh, I have to stay on these medications for the rest of
Yeah.
life. But your experience is this is not necessarily the case.
Oh, not at all. I think, and a lot of these parents, when they have this full diagnosis, which they wait a year for sometimes, and it's like, okay, there's go get ABA and there's nothing else. There is a lot of, oh my God, this is permanent, but there's a lot of hope. There's a lot you can do. I think it's important to know there are multiple factors. It can take a while to figure out, treatment, but also what it is. And, recovery isn't like this, right? Recovery is, especially with these kids, they get in flare, they regress, and you have to figure out what's going on. But there is a
Mhm.
lot of hope, and kids do get better. And I think about, you have problems with attention. That's not a disorder, it's an attention. What's causing the attention deficit? What's causing the depression? What's causing the mood issue? As opposed
Right.
to diagnosis, they're really symptoms.
Yeah. My big concern right now with the amount of infections and toxins that's getting into people is that we're really dealing with. I mean, I hate to say it this way, but it's almost like we're dumbing down society by allowing all of these infections and toxins to get into people. So we need, brilliant people for solutions for our climate emergency, and we need right. I mean,
Right.
we need the brightest people on the planet working on some really, difficult situations we're facing. And now we've got all of these people, right, with infections and toxins. And I don't think people realize that this is something we are all exposed to, but especially in kids, right? Their detox systems are not well prepared to deal with this, right, for several
No.
years.
I mean, they're basically growing a system. They're growing a brain, right? They've got neural development. Their brain is literally physically growing and developing and making connections. And if you have infections and toxins and things that are interrupting these, you're definitely going to have delays and mood issues. The amount of depression and mood issues and anxiety in kids is unbelievable. COVID just did, it's just like another infection. It's just like another layer that we didn't need that added on to all of this.
Right. You've seen your kids get worse after, like, is the post-COVID symptoms in the kids where it kind of brings out all their underlying symptoms with more fatigue, more brain fog, more pain, is just making everything worse?
Yeah, and I've seen kids kind of kids who are pans who are having like autoimmune issues and then we're doing really well, get COVID and just flare again. And then get, reactivation of EBV, and then you see the mycoplasma elevated, and you see the Lyme diseases elevated. So it really can just reactivate anything you had.
Yeah. Yeah,
So it's
we're
just
we're seeing
another
the same.
factor.
And we're seeing lately a lot of HHV6 and EBV reactivation in these
Yeah.
patients who are saying all of a sudden I got COVID and then I got the flu, and all of a sudden underlying viruses start coming out. And I think
Mhm.
for the Lyme community that's listening, although we mainly focus on the importance of parasites like Babesia and bacteria like Lyme and Bart, the fact is these viruses. They
Mhm.
are part of the picture in a lot of these patients, especially since COVID came along, because they're starting to come to the forefront with viral reactivation. And you're seeing this in the kids too.
Absolutely. And I said, when I check kids, if somebody, I check all those titers, all the different viruses, mycoplasma. It's funny, I check a lot less strep, But yeah, and I said the tick-borne illnesses, I check all of those and kind of find out where they are when
Yeah.
kids are flared. You almost have to reevaluate.
I mean,
Absolutely.
the problem I've had with the strep titers, and again, I don't see as many kids, but the ASOs and the anti-DNase antibodies, they seems to stay high for long periods of time for a lot of these kids. And I don't see enough
Yes.
of like changes in titers for me to say like, what is the chicken? What's the egg? You're exposed, but how do I know that was the cause?
Right. In terms of treating, if you're treating based on titers, it doesn't help. You're right, because they get a strep, um, and then they can stay elevated for a long time, and you can treat them, and the kids get better, and the strep titers are still elevated, even if they're better. So, which is why, don't even the general pediatricians, well, that's one of the first things they'll do, and they'll treat the titers if somebody's had strep, and but they don't correlate. You kind
Mhm.
of learn that after a while. So it's something I check less than, because I'm going to see other things, and I'm going to cover strep anyway, essentially.
So, Deb, we're getting close to about an hour on this. This was a great talk, by the way. I think this is going to give a lot of hope to parents and for kids who have either pediatric Lyme or have these problems with ADD, ADHD, and autism. So, again, tell people how they can find you, because I'm sure a lot of people are going to be interested in contacting you.
Yeah.
What's the best email address to get in touch with you?
Um, it's Dr. Debbie, and it's a DRDEBBY at holisticpediatric.com, and that's holistic with an H. And my
Great,
website is holisticpediatric.com too.
great, thank you.
So,
And
and
any
there's
any
hope.
No, there is hope. And any parting words? I mean, look, I always learn a lot because I don't see as many pediatrics. So I'm always happy to learn from people like you, in the field who are right there doing it. It does sound, to kind of put this together, that the MSIDS model that I've been doing for adults, it sounds like you are seeing the exact same thing in these kids, and that it just makes sense, excuse me, to use this map as a way of making sure that nothing's missed, because you're seeing POTS, you're seeing mitochondrial dysfunction, you're seeing all the
Mhm.
infections, the microbiome issues, the mast cell issues, the sleep, the mineral deficiencies, vitamin. It's all the stuff we're seeing in the adults. And you treat it, and you're finding that these neuropsychiatric, symptoms do get better in these kids, right?
Absolutely. Well, you
Yeah.
think about, adults and kids are going to have the same kind of exposure, and then their families, their environments are the same. I think it's just going to affect them differently because you have a developing child and a growing nervous system and an immature detox system. Um, but yeah, you have to look at all the same issues. So I can treat, I said I have a lot of, I don't know, kids, but like, young adults in their 20s and 30s, and it's the same.
Right.
You're
And,
really
and by the way,
diagnosing.
the testing, we didn't go into this in great detail, but I primarily use IGeneX. I have no, financial relationship with them, but I primarily use them. Of course, we've used T Labs. We occasionally use Vibrant. Are you using the same kind of laboratories to pick up these tick-borne infections in the kids?
Yeah, I use IGeneX. I always say IGeneX, but IGeneX, I started with them. I've tried some others, and that's the only one I really, for those tick-borne diseases, that's the only one I use.
Right. And they
So,
don't pay you to say this either, by the way. You're like
no,
me.
no,
You and I are
but you
just
have
on
to
the front lines
be honest.
going, what are some of the best labs out there? I mean, it's not a problem doing T cell assays and stuff and using, Armin labs, Infecto labs, they're all helpful, right? But ultimately, if I had to go to one first lab, right, to diagnose this, ultimately the Lyme immunoblots, the BART immunoblots, the Babesia immunoblots, right? The fish testing
Yeah,
for Babesia and BART, they're very helpful. Unfortunately, I can't get Galaxy in New York. I suspect, and I
no,
don't know how often you can get it, but the fact that there's over 17 different pathogenic Bartonella species and they do the direct Doppler PCR, you found any of
yeah.
these unusual BART species in these kids, just to finish this up while you're examining them?
Um, I mean, I do the immunoblots, and they only look kind of a couple different species. I haven't looked at Galaxy, but then if as I said, if I get Bartonella, I'm going to make sure that I cover for Babesia and Lyme. I kind of because but I have a lot of kids who come in, oh, tested for Lyme's negative. I'm like, well, not necessarily, that they're really hard to find. And Bartonella and Babesia, I don't think I've ever seen a positive test for those in like just a general lab core. So
Right. The local labs, unfortunately, they only check for one strain of the organisms. And I agree with you. I mean, I do find it on occasion, but it's very difficult to find it. You can't rely upon it.
yeah, so I don't. And I explain that to parents. It's like, if we really want to know, this is what we need to do.
Yeah.
So
Well, Deb, thank you again so much. This was really enlightening. For all of you out there who've been listening to Dr. Debbie Hamilton and myself, this has been the Healing from Lyme Summit. You're with Dr. Debbie Hamilton, who's been discussing pediatric Lyme, specifically talking about pandas, autism, and ADD, ADHD. Thank you for joining us. I look forward to seeing you all again on the next episode of the Doctor's Talk of Healing from Lyme. And Deb, I want to thank you again for taking the time to be with us today.
Yeah, so thank you so much. It's really good to discuss and get this information out there. So thank you also.
Yeah, it's my pleasure.